Hi, Dr. Sasse here from Nevada Surgical, and I was asked a question recently about the reversibility of bariatric surgery or metabolic surgery. And the question basically straightforwardly expressed is metabolic surgery reversible? So I would start by saying that the short answer is basically no, but there's always a little bit more to it than that. So let's just go through it in a little bit more detail. There remains a couple of procedures which are reversible, but they're not widely performed and they're not what we generally mean by metabolic or bariatric surgery. The first of those is the lap band or the laparoscopic adjustable gastric band. This really had its day back in the early 2010s, very widely performed, and involves a 45-minute laparoscopy and placing a band around the upper stomach. And since it's an implanted device, that device can be implanted and it can also be removed. And in fact, that's what we do. We used to think it would be permanent. We now think of it as kind of a long-term, very helpful tool that may last 10 or 15 years. And then it's removed. As over time it begins to cause some problems, constriction, migration, scar tissue, erosions, things like that. But that one is reversible. It's just that it's not the most effective procedure, and it has really given way to the procedures which are far more effective, mainly the sleeve gastrectomy. So we don't do a lot of gastric bands because net there are more complications and the need for future surgery like removal and more side effects and less effective weight loss. So the sleeve turns out to be safer, simpler, and more effective. So that's why we've kind of seen this shift away from the lap band. The second thing that you might consider reversible would be the non-surgical approach using an intragastric balloon. So that can be placed with an endoscopy in a very short little procedure, and then it's removed about 6 months later. So clearly reversible and meant to be reversible. And this is shown to be effective in that short-term duration, and then once the balloon is removed, of course, then the person is working hard to hopefully make some long-term changes on diet and exercise and keeping those pounds off over time. There's not the same sort of permanent long-term hormonal change that really changes the long-term set point trajectory of our body weight that surgery brings, but nonetheless it's a reversible procedure. What about the really primary main procedures? Are they reversible? So the first we'll talk about is sleeve gastrectomy. If you look at the illustrations, you'll see that it involves removing over half of the stomach tissue itself. That tissue is removed, it's taken out of the body, it's sent down to the lab, it's never coming back. So that procedure is not reversible in any sort of strict sense. However, sometimes what's really underlying the question of is it reversible is sort of a related set of questions. And what people sometimes really want to get at is there recourse if I have a problem? Is there a way to solve it if there's something that goes wrong? Am I going to be stuck with some permanent problem if it didn't come out well? And so, looked at in that kind of larger context, the answer with respect to sleeve gastrectomy is a resounding yes, that there is a solution. There is nearly always a way to solve a problem that comes from the sleeve gastrectomy itself. The most common of these would be someone developing severe acid reflux or gastroesophageal reflux disease. And so if you end up developing a lot of that, you can manage that with medications in almost all cases. However, in the fraction of cases where it's really severe and it's not getting better, yes, there's a surgical solution, the most common of which is converting that sleeve to a bypass. Why is that so great? Well, it's so great because it allows all the food and secretions to bypass the stomach where the acid is produced, and it bypasses the slow emptying of the stomach and the stop sign at the bottom of the stomach, the pylorus. And instead, that all flows right around it. Think of it as kind of like a wide open boulevard flowing down with the bypass. And so that's very effective, generally eliminates gastroesophageal reflux and heartburn if it's related to the sleeve. So there's an excellent bailout there. Same thing if the problem 10 years later is recurrent weight. If someone has regained their weight, then yes, revising that procedure can very definitely result in excellent weight loss once again. Again, usually converting it to the gastric bypass or converting it to a duodenal switch. Both highly effective if done, in experienced hands, which is common nowadays. Similarly, for Roux-en-Y gastric bypass, you might think, well, that seems like kind of a complicated procedure. You're rerouting the plumbing, you're creating a small stomach pouch, you're bypassing the stomach and you have to make 2 connections in the intestinal system. Could that possibly be reversible? And here the answer is, again, a little more complex. The first answer is yes, you could technically reverse all the work that was done. That's a little bit of a challenging operation, but every once in a while it needs to be done, and we can do so. It might require an open surgical technique, but the parts are all there. We haven't taken out any critical pieces, and so that can be reversed. But again, getting at the real subtext of the question, is there a sort of a remedy? Is there a card I can play if the surgery hasn't worked well enough, or if I've regained all my weight, or if I have some other problem related to the bypass? And here the answer again is yes. Both for just revising the procedure to solve weight regain or recurrent diabetes issues, or if there's some problem related to the bypass itself, corrective surgery can be done that can generally solve it. And in nearly all cases, that corrective surgery can be done with the laparoscopy, can be done very safely with minimally invasive technique and not a huge downtime or recovery time. It's worth mentioning one of those, which is something we do fairly commonly, which is if a person had gastric bypass surgery 10 or 15 years ago, let's say, and has now regained substantial amount of that weight, or is experiencing type 2 diabetes as it's starting to set in now that they're at a little older age, we can go back and we can re-enter the abdomen with our scope and camera and very small incisions, and we can redo or revise the gastric bypass, re-measuring the limbs and create a new configuration that now very strongly jumpstarts the positive hormones that result in lowered blood sugar, lowered fat storage, and decreased body weight. And so that revisionary procedure is something that can be very helpful for people, even if they think they don't have cards to play from their gastric bypass surgery 15 years ago. So I hope that's kind of helpful at framing things. While it's true that most surgical procedures today, whether they're bariatric or metabolic surgery, they're not generally truly, quote, reversible in the truest sense. You can't quite go exactly back to what was done before. But if you dig deeper and ask, well, is there a solution if I develop a problem, or in this case, if the surgery fails, or if I regain weight or diabetes? In nearly all cases today, the answer is yes, we have very good cards to play to revise, correct, and improve the situation for people for the long term. So I would say if you're kind of wondering about that, just seek out an experienced bariatric or metabolic surgeon and just describe what your situation is. Ideally bring the records of what was done before, and see if you can put your heads together about solutions that might be safely performed, that might get you to a much healthier place and better long-term health. All right, I hope that's been helpful, and I wish you the best of health.